like this slide because this is a slide that shows a young person next to an older person. On the left, you can see the younger person has a nice, rejuvenated face. She has high cheekbones. She has full cheeks. She has nice lips. She has a nice tight jawline. Her eyes, look at her eyes. She has these, if you were to look at the diameter across the upper face, you would be able to see kind of these 5 eyes across. So if you were to visually try to look across that, 5 eyes could be placed across that upper temple region. So good proportions there in the youthful face. Now look to the right, and you see the triangle has inverted. So the triangle of aging has hit. We now have loss of fat, loss of these fat pads. So we have 9 fat pads on either side of the face that extend beneath the orbit and that extend all the way down to the jawline. And that's important because we begin to lose fat in our face as we age. And with the loss of that fat, we begin to see gravity take the descent. And now we have the overlying skin then descend down. And so now you see flattening of the mid-face. You see a much more accentuation of her nasolabial folds, those folds that extend from the side of her nose down to either side of her mouth. You see thinning of her lips. You see kind of this jowling around her lower face. You see notching along her jaw there, where she has sort of this creeping up along the jawline. So now she doesn't have this nice tight contour of her jawline, but rather it just looks very jagged there. And then of course around her eyes, she's got the sunken, kind of what we refer to as the tear troughs around her eyes. So now, you know, she's not looking youthful any longer. She's seeing the signs, as are you, on her of aging. So this is how we can see this on the face. We're seeing it in 2-dimension here. We're looking at her frontally, but as you look at the patient, even from a side view, from an oblique view, a 45-degree angle, we can see these same changes occurring. On this slide, this takes that to another step. We've talked about the fat pads a little bit. Those 9 fat pads here are shown both in the model on the far left in her 30s, and then again as we hit her 40s, you start to see that shrinking of the fat pads, and then you start to see how that affects those overlying structures. And then as she hits her 50s, you see how that reduces that volume even more so, and then how that affects the overlying skin structure. And we haven't even talked too about how her underlying bone is also affected as well. So she's getting bony loss as well, and so this affects the overlying skin tissue as well. So when we have mid-facial loss, this mid-face loss of fat in the mid-cheek area, this is really the foundation of aging. So mid-face, and this is what we really want to focus on today, is this mid-face area here. If we don't address this, and if we don't address it first when we think about the foundation of how we reverse that in terms of either filling or a device, something like M-Face, if we're not focusing on this, then it is going to void everything else that we are going to accomplish. If somebody comes to me and says, "Doctor, I need you to fill these lines here," if we don't thoroughly assess that patient and see why are they having these lines that are being more accentuated here, then we're really failing that patient, because honestly, these lines are becoming more accentuated because of something else that's occurring anatomically. What is really occurring is they're having loss in the mid-face, which has led to a deeper folding in the nasolabial area. It's led to jowling down in the lower face, and that's what they're seeing when they look in the mirror two-dimensionally. How the world sees the patient and how we see others is really in a three-dimensional way. And so that's why photographs are so important, so that we can educate and teach patients about how we really need to approach the aging process, because we need to start at the foundation. The foundation of aging is really in the mid-face. And if we're not starting at the foundation, we're really failing to treat from the root cause. So there is a method to madness here, and we need to start foundationally here. So let's say someone comes in with a complaint of jowling or nasolabial folds. We need to look and assess total face. We don't need to just focus in and fill a line here, because ultimately that's probably not going to serve that patient very well. We need to look and see, are they very flat here? Perhaps they have tear troughs here that are actually being brought on due to the loss of the facial fat pads here in the mid-face, because that's where all aging really begins, as you can see from the prior slides we showed. So we're going to show you some great before and afters of patients that have had mid-face filling. And you can see it for yourself as to the kind of results they get. And I think it's important to understand in terms of quantity, one syringe of filler, such as Voluma, which is my preferred filler product for the mid-face. So 1 cc of filler equates to 1 teaspoon of product. So think about that from a quantity standpoint. 1 teaspoon equals 1 syringe of filler. If you think about 16 syringes of filler, which we would never use that all at once, but 16 syringes of filler equates to 1 tablespoon of filler, or 1 tablespoon of product, or 1 tablespoon of sugar, because this is a product that is very similar to, it's a sugar molecule, and that's why it doesn't stay in the body forever. It will break down eventually, just like these other things in our body, such as fat and bone, break down. That is what happens to these filler products. They do eventually metabolize and break down. But they have a long life, such as Voluma, which is our preferred filler for the mid-face. It has a life of at least 18 months. And due to the low mobility in this area, it typically tends to metabolize out even longer than that. Usually it lasts closer to about 2 years, sometimes even longer than that. So the good news is that this is a product that has an immediate lift, an immediate fill, and when used properly, it has a long duration. And then once you have appropriately filled the mid-face, now you're not going to require as much product in other areas, such as the nasolabial folds, if any. Sometimes you have a patient coming in with one complaint, nasolabial folds, jowling, and then they get the proper amount of mid-face filling, and now suddenly They don't need any nasolabial fold actual filling because now we've addressed anatomically their midface. We filled that properly. We've reversed the hands of time, and now they agree this looks very natural. They don't need any more in the nasolabial folds. So we don't have to directly fill their actual source of their problem, that what was their problem area they originally came in for. Same thing with areas like the tear troughs. When you start to reverse the hands of time, things that the patient has seen going south and they don't like what they're seeing in the mirror, and we then rotate tissue back to where it should be because we're putting filler back where it should have been in terms of an anatomical change. Now they don't require any filler in areas that they were first bothered by. What was the area they were complaining about? So midface, this is the foundation of aging. This is where we need to always look and assess first and determine whether the patient needs to be filled in this area, and then we can move to other areas if we should need to. But it will save them in terms of time and money if there are other areas that need to also be addressed. And Voluma seems to be the best choice, and it can also be treated using a cannula. And cannulas are not needles. Cannulas are blunt-tipped tubes, which are much safer in terms of the injection process because cannulas are not sharp and they require a much tinier needle than to insert the cannula, and then they're much less painful. So we have a much more pain-free procedure. There is much less bruisability, if any, when one uses a cannula. And now you have a much safer procedure because we're brushing by nerves and vessels when we use a tube that has a blunt end to it. And now we're able to place the product in a much safer way with a cannula. So, mid-face filling, a great way to approach the aging process.